Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss tainted herbal medicines in the EU, a new hotline number for mental health, and new techniques to improve wild elephant health. Let's wrap things up. This is episode 122 for the week of January 31st. I'm Matt Moneypenny.
And I'm Albert Battistelli.
Before we get started, our diagnosis code of the week is Z20.3, contact with and parentheses suspected exposure to rabies.
Whoa. Now that one seems like a more straightforward diagnosis code.
Yeah, there's not really like any kind of, it's like you're either suspected of having rabies or you have rabies.
Right, yeah. If you're foaming at the mouth, you might have rabies.
Yes.
Did
you see that video of the dad who like defended his dog from a bear?
No.
Oh, dude, it was wild. It was a viral thing. It was like in the middle of the night. I don't know if it was in the middle of the night, but it was in the evening, and I think it was probably in like Colorado. I'm just going to assume that's where all the bears are.
Right.
So he was just chilling outside with his dog on the porch, and they had like a screened-in porch, and the door was open, and the bear just charged in and went after the dog. And then the dad had his dad reflexes kick in, and he like defended this dog against the bear, and the bear left. But
that's amazing.
There was a comment from the person who posted it, who was the wife of the dad, and she said that the bear was he was being checked for rabies. So in that instance, his diagnosis code was probably Z20.3.
Wow, you're right.
See, it all comes back together.
Yeah, way to tie that in there.
Anyways, let's get into the news. First up, we've got potential paralysis from English herbs. The Dutch Food Agency has warned consumers about two herbal preparations with ingredients that could pose a risk to public health. The Netherlands Food and Consumer Product Safety Authority, or NVWA, advised people not to buy or use herbal preparations called Shambhala and Open Up that came from the United Kingdom and are sold on the internet. Shambhala and Open Up contain some toxins that, when ingested in high doses, can cause nausea, vomiting, and serious issues such as hallucinations, disturbed vision, and possibly paralysis. So they say toxins in this article, but really it sounds like drugs.
Sort of does sound like that.
Yeah. At first, when I said nausea, vomiting, I thought it was going to go to upset stomach, indigestion.
Hallucinations, though.
Yeah, I don't think Pepto-Bismol helps against the hallucinations or the paralysis, but close. It's close.
I'm just like interested in the name Shambhala. I don't know.
Yeah, I don't know what
that reminds me of like a lost city or something. I don't know.
A lost city.
Like, take this and you're gonna be like able to find Shambhala. Like, I don't know. Reach your own Shambhala. Like, maybe that's why you hallucinate, because you're trying to find
that's
Shambhala.
why there's toxins in it, because they're really just trying to get people to.
They're just getting you high, man.
Visit Shambhala.
Some English herbs.
Anyways, don't do drugs. But
come on, everybody, don't do drugs. New 3-digit mental health hotline number. A bill to fund Illinois' new mental health hotline passed the Senate Mental Health Committee earlier this month. The Federal Communications Commission is requiring all 50 states to create 988 as a shortcut to the National Suicide Prevention Hotline by July 16th. Illinois created a law establishing 988 last year and is now trying to secure funding for the state to field calls once the hotline opens. According to the executive director of Champaign, Illinois' chapter of the National Alliance of Mental Illness, the goal is for most 988 calls to be handled by phone operators, but have the ability to send social workers in severe cases. The bill was unanimous in committee and can go to the Senate floor once the Senate session resumes.
988.
Yeah, man. Growing up, my phone number started with 988. So that.
Whoa.
Yeah, if you couldn't remember the last 4 digits, suddenly you're talking to a National Suicide Prevention Hotline.
Yes.
Well, if that were in Ohio.
I think
either way, this is great.
Yeah, I agree. I think all the 11 numbers are taken.
411, 911. Yeah, I get that.
I think so. I Googled it one time and it was like 311 was something, 211. Yeah, here we go. 211 is the Community Information and Referral Services.
Wow.
311 is not emergency police and other governmental services. 411 is local directory assistance. 511 is traffic and transportation information. 611 is repair service. That's kind of generic. 711 is telecommunication relay service. Access to one call service, or 811 is access to one call services to protect pipeline and utilities for excavation damage.
Huh.
And then 911 is emergency. So it looks like 111 and 011 are available.
Wow.
So food for thought.
Food for thought, anybody. If you want to get
from 988 to 111.
Yeah. Either way, it's nice to just have like a short,
Agreed.
like a quick little shortcut rather than having to be like, hey, are you thinking about like suicidal thoughts or anything like that?
Call this 10-digit number.
Call this,
that
yeah,
no
make sure you
remember.
include your area code, please.
I don't even know my mother's phone number.
Right,
You expect
no.
me to know this number?
But
It's not gonna
988, that
happen.
rolls right off the tongue. That's great. And
Although
I think
there is that Logic song that is the suicide hotline number.
I did not know that.
You didn't know that?
But
Oh.
I can always appreciate a good Logic song.
Yeah. Yep, me too. I think this can go. I mean, it's starting in Illinois, but I think it should go across the board. I mean, why not?
Right.
Why wouldn't you want to have a 3-digit number?
No, and hopefully it saves lives. I mean, hopefully people, if they have like they know the resources there, they know the shortcut, they know the quick number to call. I don't know. Hopefully that's something.
Agreed.
It's good to see people taking mental health seriously in whatever capacity they do it.
Indeed. Next up, new study for elephant health. A new study for elephant health from North Carolina State University focused on omega-3 and omega-6 fatty acids, which can be measured in blood and tell us a lot about an animal's health. The study found a technique that uses dried spots of blood to measure health indicators in elephants. Turns out it is comparable to techniques that use larger blood samples and requires immediate cold storage. This technology is not always available when monitoring animals in the wild. The new alternative is dry blood spot sampling, or DBS. This technique requires only a few drops of whole blood, which are dried on specialized filter paper. The researchers are hoping this work will enable the research and conservation community to collect more samples from wild elephant populations, since it will be easier, less expensive, and less stressful for the animals. That could help researchers to better understand the health of wild populations and how that compares to the health of managed elephant populations. Ultimately, they think this can help scientists continue to improve diet and other conditions for managed elephant populations and other species. I like how this said whole blood.
Yeah, I saw that. Weird.
It's like not 1% blood. We're
No.
not talking skim blood.
We don't want
or
skim
2%.
blood. Right.
We want whole blood. Not
Whole
whipping blood, but whole blood.
Yeah, heavy whipping blood.
Not
Very
evaporated blood, not sweetened condensed blood. Just kidding.
No. Not an alternative, not a dairy alternative
We're
blood.
not talking, we're not talking oat
blood or almond blood.
That is a ridiculous bit. Anyways.
Yes, it was.
That's cool. I mean, conservation's great.
No, yeah, absolutely. And I think, that's just really like kind of blows my mind that they can take dry blood and like figure out almost everything about this elephant's health. Like,
yeah, that's true.
We know how much it weighs. We know what its diet is. We know what it's doing. We know how long it's going to live based on this
how much exercise it gets every day.
Right, exactly.
Per day, all of it.
Incredible, yeah.
What it smelled, the scent
right.
it smells. I mean, I don't know. This stuff, we're just making this stuff up, but a lot of stuff you can get from the blood.
Absolutely. And it's just really cool to see that they can like actually use that for something like helpful.
Yep. Absolutely.
Manage these populations, man.
Yeah, conservation. 64.
Right. That's what we always say on this show.
Yep. And with that, let's go to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. We talk about the latest breaches all across the world. Oh my gosh, Albert, what do we got?
All right, Exelis 2015 breach settlement. A settlement has been reached in a class action lawsuit over a data breach that hit Exelis health plan several years ago. That breach was discovered in 2015, and the cyber attack affected more than 10 million people at the time. There was a class action suit, and attorney Hadley Lundback Matarazzo with the Western New York-based law firm Faraci Lang LLP is a co-lead counsel for the plaintiffs. Exelis made no admission of liability and said it agreed to terms for injunctive relief, which is focused on ensuring that the health plan maintains a certain level of commitment and investment in its information technology and security practices. The settlement does not preclude people affected by the data breach from suing for monetary damages. A federal judge will conduct a hearing for the final approval of the settlement of the class action suit on April 13th, 2022. So stay tuned.
10 million people.
That's a lot. That's a good chunk of people.
I talked about this, I think it was last episode. There was a class action lawsuit that happened, and they came to a settlement, and they were found that they need to pay X, Y, and Z, but it was a massive amount of people. So it's class action lawsuits are great because they have big numbers, but then at the end of the day, it's like, how much money are you really going to give to these 10 million people that were affected by a cyber attack?
Right, like $12 each.
Yeah, maybe not even. I mean, it's the $1 each. It's $10 million right there. That's a ton.
Right, that's true. Wouldn't even buy lunch.
No, it wouldn't even. Maybe buy a gumball these days.
A gumball, yes.
So I don't know. Well, stay tuned for Exelius. But that was a breach in 2015. So that was 7 years ago.
Yeah, and we're still talking about it. So
wow.
So everybody listening, you don't want to be that guy that we're still talking about 7 years later.
Yeah, don't be that. Don't be that organization.
Yeah, don't do it.
Don't do it. Next up, cyber attack coming to a close. A cyber attack on Memorial Health System in Ohio may have exposed the PHI of 216,478 patients altogether. The health system was hit with ransomware in the early hours of August 15, 2021. The incident forced the health system to suspend user access to all information technology applications related to its operation. A press statement gave the impression that Memorial Health System had opted to pay its attackers. An investigation into the security incident determined that attackers had broken into the health system's network in July 10th of 2021, then waited a month to deploy the ransomware. By December 9th, 2021, it had become clear that patients' names, addresses, social security numbers, medical treatment information, and health insurance information may have been viewed and stolen. Memorial Health System began notifying impacted patients via letter on January 12, 2022. Individuals affected by the data breach have been offered a complimentary 12-month membership to Kroll's Credit Monitoring Service. Pretty boilerplate response.
Yep.
200,000 people is a lot.
It is.
A lot of Ohioans. It's like the whole population of Ohio. I'm just kidding. Not. Ohio's population is like...
It's a lot, though. Yeah, it's way more than that. But still, it's a lot, and it's very specific. I thought that. It didn't just say over 200,000. It was no, we know exactly how many people.
No, yeah. And we're going to put that in this because you need to know.
Yeah, right. It's a lot of people.
It is. It is a lot of people. Ransomware affects everybody.
It does. It's,
you can't even walk outside. You can't even walk outside anymore and not get breached.
No.
Hey, I'm going to go to the
drive-by breaching. It's a drive-by breach.
Yeah, I'm going to go to the movie theater and use my credit card. Oh, you got breached. Oh, geez. It's gosh. There's no way to stop it, it feels like. It just comes down to training your employees, Albert.
Yeah, there is a way to stop it, Matt. There is, and it's just called being prepared.
And staying vigilant.
Staying vigilant, like we always say on the show.
Yeah, conservation.
Conservation. What was it, 64?
Yeah, 64.
We always say. All right. Next up, Spokane Health District breach. The personal health information of more than 1,000 people may have been disclosed. Okay. So coming off of a story where it was 214,000 down to one, I'm not going to lie. It feels like we're underwhelming here. We're ending on mix the order. We're going to stick with it anyway. The personal health information of more than 1,000 people may have been disclosed when staff at Spokane Regional Health District opened a phishing email. The data breach happened on December 21st, 2021. SRHD information technology staff were immediately alerted and discovered files containing client-protected health information may have been, quote-unquote, previewed by a data thief. The release says their investigation did not find any documents had been opened, accessed, or downloaded. The potential disclosure affects 1,058 people and includes first names, last names, date of births, case numbers, counselors' names, results and dates of urinalysis, medication received, and the date of last dose. The health district has already notified those whose data was impacted. They have also implemented corrective actions to ensure a similar situation does not happen again. Yeah. So watch out for those phishing emails, folks. That's like
Phishing,
classic
move.
Classic move. Hook, line, and sinker, man. And I said that's a pun on phishing.
Wow.
But right.
You're just a genius. Comedy genius.
I'm trying out my new bits on the show.
Just trying out new things.
Just trying out my new material on you guys.
Did you know that phishing is the number one cause of ransomware? So with that information, we can assume that the last breach that we just went over that affected 200,000 people might have happened because of phishing.
A little phishing email.
But actually, it doesn't. No, it just says that they broke into the health systems network on the previous story. So maybe it wasn't phishing, but that's rare.
Right. Phishing is common.
Watch out, phishing.
Check those emails.
Check them and don't click anything until you know that it's legit.
Right. Exactly. If you see something, say something.
If it was
really
exactly,
what it is.
If it said something like
trademark me. I made that up.
It'd be great if you open an email that you thought was suspicious and it says click this link, and the link says if you click this link, you're going to lose your health information. So please don't. But then in that case, I feel like people would probably click it out of spite just to be like, it's like almost reverse psychology.
Right. But don't hit the big red button and then you hit the big red button.
Is that it's not really, it's not the case. They make it deceiving on purpose and they send it on a wide scale. So your entire organization is probably going to get the same phishing attempt. And all it needs to happen is one person to click on it. Just keep that in mind.
Yep.
And that's it for this week's wrap up of your weekly healthcare news. I'm Matt Moneypenny.
And I'm Albert Battistelli.
And we'll see you next week.
Thank you for listening to the Bandage Podcast produced by eTactics.